Welcome to the deep dive. Today we're plunging into a challenge in the agriculture world that often goes unnoticed.
That's right.
It's this kind of hidden complexity. Costs producers millions, impacts animal welfare significantly.
Hmm.
Yet, for all its prevalence and cost, it's something most people outside the industry just rarely consider.
Yeah, definitely flies under the radar for most.
We're talking about porcine hernias. Now, I know it might sound incredibly niche, right?
You might seem that way at first glance.
But it's actually a perfect example of how these seemingly simple issues in animal health, well, they're deeply rooted in genetics, environment, economics. It's all intertwined.
Exactly. It connects a lot of dots.
So our mission today is to basically extract the most important nuggets of knowledge, the key insights from a stack of comprehensive analyses and research on this topic. We want to offer you a shortcut to being really well informed.
Kind of distill it down.
Yeah, exactly. Our goal is for you to gain a thorough understanding of what is actually a critical animal health issue. We'll cover some surprising facts, practical implications, but hopefully without getting you bogged down in overly technical jargon.
Keep it accessible but deep.
Okay, let's unpack this then. At its core, a porcine hernia. It's an anatomical defect, right? Abdominal organs are protruding.
That's the essence of it, yeah.
But as you hinted, not all hernias are created equal. For producers, understanding the precise classification, the specific anatomical failures involved, that seems absolutely fundamental.
It really is. Knowing the what and where is step one.
So let's start with umbilical hernias. What's happening there and why is it so important to grasp the specifics?
Right. So umbilical hernias, they stem from a failure of a postnatal healing process. Essentially, you have the umbilical ring where the cord connects, It should close up tightly after birth.
Oh, okay.
Sometimes it remains open or weak. And that allows abdominal organs like bits of omentum or intestine to push through.
Wow.
And we call this a direct hernia. That's important because the contents are basically in direct contact with the overlying skin, just held in by the peritoneum and the skin itself.
In that direct contact, what does that mean practically?
Well, it means there's a higher risk of adhesions. That's where the intestine can actually stick to the inner lining of that hernial sac.
Which sounds like it could cause problems.
Oh, definitely. It complicates digestion, and it makes any potential surgical repair trickier, too. That visible ball-like lump you sometimes see on a piglet, that's the external sign.
Okay, so that's umbilical direct postnatal healing issue. What makes inguinal and scrotal hernias different then? Where do those originate?
That's a crucial distinction, and it ties directly back to their developmental origins. Inguinal and scrotal hernias, they arise from a structural weakness or defect in the inguinal canal.
The inguinal canal. Remind me.
Sure, it's a natural passageway down in the lower abdominal wall. In male pigs, it's absolutely vital because it's the path the tests take to descend from inside the abdomen down into the scrotum before or shortly after birth.
Got it.
So if that canal doesn't close properly after descent, or if it's just inherently too large or weak, well, abdominal contents can push through it.
Okay, makes sense.
And the distinction then is, an inguinal hernia means the contents protrude into that canal itself. A scrotal hernia is sort of the next step. The contents have passed completely through the canal and ended up down in the scrotal sac.
And what kind of contents are we talking about? Similar to umbilical?
Often, yes. Small intestine is common, sometimes the cecum, even parts of the seminal vesicles, or occasionally the urinary bladder can end up in there.
Wow.
And importantly, unlike the umbilical type, these are typically indirect hernias. The organs are pushing into a pre-existing pouch or canal. The process is vaginalis, technically. It's almost like pushing your finger into a glove finger, rather than just bursting through an opening in the main abdominal wall like the umbilical ones.
So direct versus indirect, that seems like a key takeaway.
It really is. Because this difference in their anatomical origins, it provides a really logical framework for understanding the causes. Umbilical hernias, being about that postnatal healing failure, they're much more susceptible to environmental factors. Think bacterial infection of the navel stump. That's a big one.
Right.
In contrast, inguinal and scrotal hernias, because they're tied to that fundamental developmental pathway of testicular descent, they're much more intrinsically linked to congenital and genetic factors.
I see.
And knowing that distinction, it's paramount for producers when they're trying to figure out where to focus their prevention resources. Is it hygiene in the farrowing house, or is it looking more closely at their genetics?
Okay, so we've got different types, different origins, but on the farm, day to day,
Yeah.
how do you tell a true hernia from something else that might just look similar? Sounds like that could be tricky.
It absolutely is a critical diagnostic process.
Yeah.
The initial diagnosis, well, it really relies heavily on just visual inspection
Mhm.
and then very careful palpation actually feeling the swelling.
What are you feeling for?
You're assessing its size, its consistency.
Mhm.
Is it soft, firm, hard like a rock? And crucially, its reducibility. Can you gently push the contents back into the abdominal cavity?
And why is that reducibility so important?
Because that's where the diagnostic dilemma really comes in. Let's take umbilical defects. The main thing you need to differentiate from a true hernia is an umbilical abscess.
An abscess. So just an infection.
Exactly. A localized collection of pus, usually from an infection tracking up the navel stump. But critically, there's no actual hole or defect in the abdominal wall itself.
Ah, okay. So palpation helps distinguish that.
It's key. An abscess typically feels firm, maybe warm, and it's non-reducible. You can't push it back in. Whereas a true, uncomplicated umbilical hernia often feels softer and you usually can gently push the contents back through the underlying ring or defect in the body wall.
And what about down in the inguinal or scrotal region? What else could cause swelling there?
Good question. Beside a hernia, you might be looking at things like a testicular hematoma, basically a blood clot, maybe from trauma, or a serose cord, which is this fibrous, hard growth that can happen after castration, or even a hydrocele, which is just a collection of fluid within the scrotum making it look swollen.
So palpation gets you partway there. But if you need a really definitive answer, beyond just feel and look, what tools can help?
Yeah, sometimes you need more certainty. Ultrasonography is incredibly valuable here. It can give you a clear image. It can show you definitively if there's a hernial ring, that actual defect in the abdominal wall. And it can help identify the nature of the contents inside the sac. Is it loops of intestine? Or is it just fluid or maybe solid tissue consistent with an abscess or a hematoma?
That sounds much more precise.
It is. And this brings up a really important point about that diagnostic dilemma at the farm level. There have been necropsy studies, postmortem exams on pigs that had visible umbilical outpouchings. And they found that about half of them weren't true hernias at all. They were actually just abscesses or maybe cysts with no underlying hole in the abdominal wall.
Half. Wow.
Yeah. So think about the implications. If producers are making culling decisions, maybe for selecting future breeding stock based purely on a visual diagnosis of hernia.
But it's actually an abscess.
Exactly. They risk making incorrect and potentially very costly genetic selection choices. Removing an animal for an abscess, thinking it's a heritable hernia defect.
That really highlights the need for better diagnostics on farm then.
Absolutely. Like making routine, careful palpation standard practice just to confirm if there's actually a reducible hernial sac and if you can feel that underlying ring.
Yeah.
It seems basic, but it's critical.
Okay, this is where it gets really interesting for me. We've touched on the economic impact, but let's talk scale. How common actually are these hernias across the swine industry? Do we have solid prevalence rates?
We do, and they paint a significant picture. Porcine hernias are right up there among the most frequently observed congenital defects in pigs. Yeah. If you look at the overall prevalence of all congenital defects, it varies a lot. But studies often put it somewhere between, say, but 1% and maybe up to almost 5% of pigs born.
Okay.
Now, zeroing in specifically on combined umbilical and inguinal hernias, the prevalence within affected herds often falls in the range of about 1.7% to maybe 6.7%, though some broader population surveys might cite a lower baseline, maybe 0.4% to 1.5%.
So there's quite a range there.
There is, and it gets even more specific when you break it down by type. For umbilical hernias, that 0.4% to 1.5% range is often quoted generally. But then you see studies like a big Danish survey that found much higher average within herd prevalence, like 4.2% in young piglets, and still nearly 3% in weaned pigs.
That's quite a bit higher.
It is. And for scrotal and inguinal hernias, the variation is even wider. Reported rates go from as low as, say, 0.22% in some populations, up to over 9% in others, depending heavily on the specific breed, the genetic line, and maybe the production system.
Over 9%.
And get this, in some specific genetic lines that have been identified as problematic, the incidence of scrotal hernias has been reported to reach as high as 30%.
30%. Wow, that's huge. I would not have guessed it could get that high.
Exactly. And zooming out, looking at the bigger picture, this really wide variation in reported prevalence, especially the huge range we see for scrotal hernias, is pretty strong epidemiological evidence. It points powerfully to the influence of genetics.
How so?
Well, the occurrence of what people in the industry call hernia storms, these sudden dramatic spikes in incidence rates, within a particular herd or system.
Yeah.
Often when you trace it back, it points directly to problematic genetics introduced from maybe one specific boar or a particular sow line. So a seemingly low industry-wide average can easily mask these really devastatingly high incidence rates happening on individual farms if they've unfortunately received genetics from one of those problematic lines.
So the economic hit is clearly significant, from pigs being devalued or culled, maybe even carcass condemnation at the plant. But you mentioned welfare earlier. This isn't just about the money, is it?
No, absolutely not. You're spot on. Beyond the spreadsheets and the economics, hernias represent a really significant animal welfare issue.
How do they actually impact the pigs themselves, beyond just the financial bottom line?
Well, even a small, initially uncomplicated hernia can lead to considerable suffering, especially if it grows large. The skin stretched over that protruding sac becomes really thin and vulnerable.
Prone to injury.
Very prone to trauma, yes.
Mm.
Rubbing on floors, getting stepped on, leading to ulceration, nasty infections. And large hernias can physically get in the way, impeding movement, making it harder for the pig to comfortably lie down or even reach feed and water properly.
That sounds miserable.
It is. And then there's the most severe welfare event, intestinal strangulation.
Strangulation.
Yeah. That's where a loop of bowel gets trapped tightly within the hernial ring, and its blood supply gets completely cut off. This causes acute, excruciating pain. It's an emergency, and if it's not addressed immediately, which often isn't feasible in a commercial setting, it leads to tissue death and a rapid, painful death for the pig.
That's grim.
It is. And furthermore, there are regulations. In many countries, pigs with hernias that are ulcerated, clearly infected, or so large they're touching the ground, they're deemed unfit for transport.
Meaning they can't even go to market.
Exactly. They can't legally be loaded onto a truck and sent to the slaughter plant. So they have to be humanely euthanized right there on the farm, which, from an economic standpoint, is a total loss for the producer.
Wow.
And there's even subtle stuff. Some studies suggest that even pigs with hernias that don't show obvious clinical signs like lameness or infection, they might still be less fit. They might cope less well with the social mixing and crowding that often happens in pens just before transport. It hints at some underlying stress or discomfort, even if it's not immediately obvious.
So, clearly a major issue on multiple fronts. What are the fundamental reasons these hernias develop in the first place? It sounds like it's not just one simple thing, right? It's more complex.
Precisely. It's definitely a complex interplay of factors. We talk about a multifactorial etiology. It's not usually a single cause, but rather an interaction between an animal's underlying genetic susceptibility and various environmental or management-related triggers.
Okay, genetic susceptibility plus environmental triggers.
Yeah, and a useful way to think about this is something called the threshold model.
Threshold model.
Yeah, imagine an animal has a certain genetic predisposition, maybe for slightly weaker connective tissue, let's say. That's its genetic load.
Okay.
But that animal might not actually develop a hernia unless or until it encounters specific environmental stressors. Things like maybe a navel infection right after birth, or a sudden increase in abdominal pressure from piling up with other pigs. Those stressors can push that susceptible animal past a critical developmental threshold.
And then the hernia appears.
Exactly. It's that combination. And this model helps explain why hernia incidence can sometimes stay relatively low for a long period and then suddenly spike those hernia storms we mentioned. It might happen when, say, a new genetic line with a higher susceptibility is introduced into an environment with existing stressors, or maybe management practices slip, increasing the environmental pressure on even moderately susceptible animals.
So let's dig into the genetic side a bit more. What do we know about the genetic architecture?
Well, we know hernias are recognized as complex polygenic traits.
Polygenic meaning many genes involved.
Exactly. Not just one single hernia gene, but rather the combined effects of variations in multiple genes contribute to an animal's overall risk.
Right.
And we can quantify this genetic influence using heritability estimates, often written as H-squared. Heritability basically tells us how much of the variation we see in the trait, in this case, having a hernia or not within a population, is due to genetic differences among individuals.
And what are the heritability estimates for these hernia types?
They differ significantly. For scrotal and inguinal hernias, the heritability estimates are generally considered moderate to high. Studies report values ranging quite widely, but often in the 0.2 up to maybe even 0.86 range in some specific populations.
High heritability means Genetics play a big role.
A very significant role, yes.
Yeah.
It indicates a substantial inherited component to the risk. And importantly, it means that genetic selection, choosing not to breed from affected animals or their close relatives, can be a highly effective tool for reducing the incidence over generations.
Okay. And umbilical hernias.
For umbilical hernias, the heritability estimates are generally more moderate, maybe in the 0.25 to 0.51 range. Still significant, meaning genetics definitely plays a part.
But maybe less strongly than for scrotal inguinal.
Exactly. That comparatively lower value suggests that environmental factors likely play a relatively larger role in whether or not an umbilical hernia actually develops compared to the inguinal or scrotal types.
And beyond just heritability numbers, has research pinpointed specific genetic regions or genes?
Yes, definitely. A lot of work has gone into identifying what are called quantitative trait loci, or QTLs. These are specific regions on the pig's chromosomes that statistical analyses have shown are strongly associated with the risk of developing hernias.
Have they found many?
Quite a few. For scrotal and inguinal hernias, QTLs have been implicated on over a dozen different chromosomes. There's a particularly strong and repeatedly identified signal on chromosome 8, for instance. For umbilical hernias, different QTLs have been mapped to other chromosomes like 4, 6, 7, and others.
And do we know what genes are in those regions?
We're getting there. Research is identifying specific candidate genes within these QTL regions. For scrotal inguinal types, many candidate genes are involved in things you might expect: muscle development, tissue integrity, collagen metabolism. There's also evidence linking it to hormone signaling, like the androgen receptor gene on the X chromosome. A key finding seems to be a general downregulation, or sort of turning down, of genes important for muscle structure right in the tissue of the inguinal ring in affected animals.
Interesting. And for umbilical?
For umbilical hernias, the candidate genes often relate more to the extracellular matrix, the scaffolding between cells, how it forms and remodels. Also, genes involved in immune function, which makes sense given the link to infection, and some muscle development genes too.
Is there any overlap?
Intriguingly, yes. Some candidate genes and molecular pathways seem to be associated with both umbilical and inguinal scrotal hernias. This suggests there might be some shared underlying biological mechanisms, perhaps related to a more generalized weakness in connective tissue development or repair, that could manifest as either type of defect depending on other factors.
So genetics clearly loads the gun, as the saying goes. But environmental factors often pull the trigger, especially, it sounds like, for umbilical hernias.
That's a perfect way to put it. Environmental triggers are hugely influential, particularly for umbilical hernias, which, remember, arise from that failure of postnatal healing.
Right.
So think about the perinatal period right around birth. Umbilical cord trauma is a major risk factor.
Trauma like what?
Things like maybe during a difficult birth, if someone pulls too hard on the piglet, or the cord stretches excessively, or even just improper technique, like placing those little navel clips too close to the skin, they can damage the underlying muscle tissue and create a weak spot right from the start.
Okay.
But arguably, the single most significant environmental trigger for umbilical hernias is umbilical infection. Omphalitis, technically.
Infection of the navel stump.
Exactly. If the farrowing environment isn't clean, if it's damp or contaminated, pathogenic bacteria, common ones are Truporola pyogenes, various Staphylococcus species. They can easily colonize that fresh, vulnerable umbilical stump.
And the infection stops it healing properly.
Precisely. The inflammation and tissue damage caused by the infection directly interferes with the natural process of scarring and closure of that umbilical ring. It leaves a persistent defect, and that's your hernia starting point.
Okay, so perinatal factors are key. What about later on, after weaning? Do environmental factors still play a role as the pigs grow?
Oh, absolutely. Post-weaning factors definitely contribute too. Anything that chronically or suddenly increases the pressure inside the abdomen can potentially force abdominal contents out through any pre-existing weak spot, whether it's umbilical or inguinal.
Like what kind of things increase pressure?
Well, think about pigs huddling together too tightly if they're cold. That increases pressure. High stocking densities in pens can do the same. Even facility design things like having small openings pigs have to squeeze through, or high steps they have to climb over to get to feeders or waterers that can cause straining.
Right. Physical exertion.
Exactly. And then there's just outright physical trauma. Rough handling by farm staff, or even aggressive social behaviors between pigs, fighting, wrestling a sudden blow to the abdomen could potentially initiate or worsen a hernia.
So it's a constant interaction. Now, if a pig does develop a hernia, what are the options? What can actually be done about it? And maybe more importantly, what truly works, both clinically and economically, in the real world of commercial swine production? Because I sense there might be a disconnect there.
There's a profound disconnect. You're right. Let's talk about what can be done first. For young piglets, especially with smaller, uncomplicated hernias, there are actually several low-cost, non-surgical methods that have proven surprisingly effective. These are often the most practical and economic options for on-farm use.
Like what?
Well, for inguinal hernias in young male piglets, taping can work quite well.
Taping, like with adhesive tape.
Exactly. You carefully wrap adhesive tape around the piglet's hindquarters to apply constant, gentle pressure over that inguinal region. It basically keeps the intestines from protruding out, giving the inguinal ring a chance to close up naturally through scar tissue formation. It sounds simple, but studies show it can be fast, inexpensive, and give results comparable to surgery in those early cases.
Interesting. What about for umbilical hernias?
For still recent umbilical hernias, another non-surgical option is using elastrator rings. These are the same kind of strong rubber rings sometimes used for castration or tail docking. You carefully manipulate the hernial contents back into the abdomen, then place the ring tightly around the base of the empty hernial sac right against the body wall. This cuts off the blood supply to the sac, causing it to necrose, wither, and die, and eventually just fall off after a week or two. The cost is minimal, literally cents per peg.
Wow.
And for very small umbilical defects, sometimes chemical cauterization is used. This involves injecting a small amount of a mild irritant solution like dilute iodine or even just sterile saline into the tissues around the hernial ring. The goal is to induce a controlled inflammatory response that stimulates connective tissue formation, essentially scarring the small defect closed.
So those sound like pretty practical, low-cost options for the farm. But what about actual surgery? Is that ever a viable option, maybe for more valuable animals?
Yes, surgical repair is definitely the standard of care for larger or more complicated hernias, and it's much more likely to be considered for higher value animals. Think breeding boars or gilts, or perhaps even pet pigs where cost is less of an object.
What does surgery involve?
The traditional approach is called herniorrhaphy, or primary suture repair. Essentially, the surgeon makes an incision over the hernia, carefully dissects the hernial sac away from the surrounding tissues, pushes the contents back into the abdomen, and then closes the defect in the abdominal wall, the hernial ring, using sutures.
Does that work well?
It can be effective, especially for smaller defects. But the problem with just suturing large defects closed is that it puts a lot of tension on that suture line. This increases the risk of the repair failing and the hernia recurring later on.
Ah, okay. So what's the alternative for large ones?
To overcome that tension issue, surgeons often perform a hernioplasty, which means using some kind of mesh reinforcement.
Mesh, like a patch.
Exactly. A piece of surgical mesh is placed over or under the defect and sutured in place to provide extra support and allow tissue to grow into it, creating a much stronger, tension-free repair. This significantly reduces the recurrence rate for large hernias.
What kind of mesh do they use?
There are basically two main types. Synthetic mesh, often made of materials like polypropylene, is very strong, permanent, and relatively inexpensive. But being a foreign body, it carries risks like chronic infection, excessive scar tissue formation, or adhesions.
Okay, and the other type?
The other type is biologic mesh. This is derived from processed animal tissues, like pigskin dermis or small intestinal submucosa SIS. The big advantage is that it's much more resistant to infection and is gradually remodeled and incorporated into the pig's own tissue over time.
Sounds better, but I'm guessing more expensive.
Considerably more expensive, yes. And while it handles infection better, it might not provide quite the same long-term tensile strength as some synthetic meshes. There are also some novel surgical techniques being explored, like using a flap of the pig's own peritoneum, the lining of the abdomen, to close the defect. That's cost-free and biocompatible. And minimally invasive laparoscopic techniques, like keyhole surgery, have been successfully demonstrated in pigs.
But probably not practical for most farms.
Not yet economically feasible for routine use in commercial production pigs, no. So when you're choosing a treatment, you're always balancing the clinical success rate with the welfare implications and, crucially, the cost.
Right.
Surgical repairs, especially mesh repairs, generally have a highest success rates for complex cases. But those non-surgical methods, like taping or ringing, can be highly effective for their specific indications, particularly in young piglets. From a welfare standpoint, Any intervention, surgical or non-surgical, is going to cause some degree of pain or discomfort, requiring appropriate anesthesia or analgesia.
But doing nothing also has welfare costs.
Exactly. The welfare implications of leaving a significant hernia untreated, the chronic pain from ulceration, the impaired mobility, and especially that risk of acute, excruciating pain from intestinal strangulation are often far, far greater than the temporary discomfort of a properly managed treatment procedure.
So what's the bottom line in commercial production?
The reality is, those most clinically effective treatments, like a complex surgical hernioplasty potentially using expensive biologic mesh, are often the least economically viable options for your average commercial market hog destined for slaughter. The cost of the procedure would likely exceed the value added.
Which brings us back to prevention.
Precisely. It reinforces the point that for the vast majority of the swine industry, putting an aggressive focus on preventing hernias in the first place is vastly superior to, and ultimately much more cost-effective than, trying to treat them after they've already developed.
Okay, so given those economic and practical realities, prevention is clearly the way forward. What does a comprehensive modern prevention strategy actually look like? It sounds like it needs to be multifaceted, tackling both the genetic side and the environmental triggers.
It absolutely has to be. A robust program requires addressing both, and it really involves shared responsibility. Genetic suppliers have a role, and commercial producers have a role.
Let's start with genetics. What are the strategies there? You mentioned it's the most powerful long-term tool, especially for the scrotal and inguinal types.
Right. Phenotypic selection is the cornerstone, the traditional approach. This means rigorously culling animals based on visual observation and palpation. At the absolute minimum, any boar found to have a hernia should never be retained for breeding purposes.
Makes sense.
A more aggressive strategy, often used within the breeding company's nucleus herds, is to cull not just the affected piglet, but its entire litter of full siblings from potentially entering the breeding program. In some really high-incidence situations, even the dam might be culled if she consistently produces herniated offspring.
That sounds pretty strict.
It needs to be to make progress. And now, with the rapid advancements we've seen in genomics, we have more sophisticated tools like marker-assisted selection, or MAS.
Using those genetic markers you mentioned earlier.
Exactly. By leveraging those identified QTLs and specific DNA markers, SNPs, associated with hernia risk, breeding companies can now genotype their potential breeding animals at a very young age. They can screen them for these genetic markers and select against individuals carrying the undesirable alleles, the versions of genes associated with higher hernia risk.
So it's more precise than just looking at the animals.
Much more precise and potentially much faster. It allows them to make selection decisions with greater accuracy and speed up the genetic improvement process for reducing hernia susceptibility in their lines.
Okay, so that's the genetics side. What about on the farm? What are the best management practices for environmental control? This sounds particularly critical for the umbilical hernias, where you said infection and trauma are such key triggers.
You're absolutely right. Environmental management is critical, especially for umbilical hernias. It really starts in the farrowing house.
What are the key things there?
Strict hygiene is paramount. Thoroughly cleaning and disinfecting farrowing crates between sows is essential. Using drying agents on the mats can help keep the environment dry and reduce bacterial load. Applying a naval disinfectant, usually an iodine dip or spray, to all piglets shortly after birth is a really crucial step to prevent naval infections.
And handling the piglets.
Staff training is vital. Gentle piglet handling, especially during assisted births, is important to avoid putting excessive traction or trauma on that umbilical cord. And if naval clips are used, ensuring they're placed at a safe distance from the skin, not too tight against the body wall.
Okay, that covers farrowing. What about later, in the nursery and grow finish stages?
Good environmental management continues to be important. Things like ensuring proper stocking densities and good thermal comfort are key. Why? Because it helps prevent pigs from piling up or huddling excessively, which, as we discussed, increases abdominal pressure.
Facility design, too.
Yes, facility design plays a role. Avoiding things like very small openings or high steps that require pigs to constantly strain or squeeze through can make a difference. And implementing low-stress handling techniques throughout the production cycle helps minimize fighting and aggressive interactions that could lead to traumatic injuries. So if we try to put this all together into a kind of holistic framework, effective long-term hernia control really requires systematic and data-driven record-keeping and monitoring.
Tracking the problem.
Exactly. Producers need to maintain meticulous records of hernia incidents. And crucially, those records need to be linked back, whenever possible, to the specific sire and dam of the affected litters. This data is invaluable for identifying if a particular genetic line or specific boar is contributing disproportionately to the hernia problem on that farm.
And sharing that data.
Yes, collaboration with the genetic suppliers is essential. Producers should ideally have a transparent relationship where they can regularly provide feedback on the hernia rates they're actually observing in their herds with specific genetic lines. This real-world performance data allows the genetic companies to identify and address potential issues within their nucleus populations much more effectively.
What about the role of the veterinarian in all this?
The herd veterinarian plays a central role. They're key in developing and overseeing the overall health program, including biosecurity and sanitation protocols that reduce infection risk. They can help diagnose root causes when problems arise, distinguishing between primarily infectious triggers versus underlying genetic issues. And they could advise on the most humane and cost-effective management strategies for any animals that do develop hernias.
So it really takes a team effort.
Absolutely. Bringing all this together, it becomes really clear that trying to tackle hernias with just a purely genetic strategy or just a purely environmental management strategy, well, it's probably destined for failure or at least limited success.
Needs to be integrated.
Exactly. The most successful approach is integrated. It combines that rigorous genetic selection happening upstream at the breeding company level with meticulous, consistent on-farm management focused on hygiene, handling, and environment. Achieving long-term reduction really requires a collaborative partnership across the entire production chain.
Right. So just to recap then, porcine hernias. They're clearly complex, multifactorial defects driven by this interplay of genetics and environment. They represent a persistent and sometimes significant source of economic loss for producers and, just as importantly, a real animal welfare compromise in the swine industry.
Well summarized.
And while various treatments exist, from taping and ringing to complex surgery, their economic viability in typical commercial settings is often pretty limited.
That's the hard reality.
Which really reinforces that prevention through combined genetic selection and excellent on-farm management is unequivocally the most effective, the most sustainable, and the most economically sound strategy in the long run.
Couldn't agree more. Prevention is key.
So, thinking about all this, what does it all mean for you listening? Maybe consider how this deep dive into something as specific as pig hernias actually illuminates a broader truth. That in many complex systems, whether they're biological like this or economic or even societal, what look like simple problems on the surface often have these really deep interwoven roots. Genetics, environment, behavior, economics, it's all connected.
That's a great point.
So how might understanding this kind of multifactorial approach to a farm animal health issue, how might that help you think differently about other complex challenges you encounter, maybe in public health or conservation or even managing teams or organizations, something to perhaps mull over?
Definitely food for thought.
Thank you for taking this deep dive with us.